Hi everyone, we're Team 5 and we'll be presenting on Brazil's family health strategy, delivering community-based primary care in a universal health system. Our team is made up of Loretta, Jeffrey, Marie, and Lon.
A healthy nation is a wealthy nation. Countries around the world are looking to achieve a well-developed healthcare system for its citizens. This means access to comprehensive quality healthcare services, which is vital for promoting and maintaining good health. Diagnosing, preventing, and managing disease, reducing unnecessary disabilities and premature death, and to achieve health equity for all. Our presentation examines the Brazil healthcare system and how it compares to the United States, what the United States can learn and implement from Brazil, as well as what Brazil can learn and adopt from the U.S.
Overall, Brazil is the 5th most populated country in the world and has the 9th largest economy. Their government healthcare expenditures are 11.8% of their national GDP. In Brazil, healthcare is a universal right. Public healthcare is provided to all Brazilian permanent residents and foreigners in Brazilian territory through the national healthcare system.
Brazil's health system has come a far way. Brazil has made extraordinary strides in developing their social programs and efforts to provide a comprehensive healthcare system. In 1985, Brazil was in a state of transition to democracy after a 21-year-long military dictatorship. In 1988, under their new federal constitution, the Brazilian government declared healthcare a universal right. Healthcare is a right for every citizen and a duty for the government. Public health care is provided to all Brazilian permanent residents and foreigners in Brazilian territory through the national health care system. Brazil's family health strategy is one of the largest primary health care programs. In 1994, the Family Health Strategy Program started a federal program to provide integrated primary care. Their strategy is to provide basic health care using a team of medical professionals with defined roles: physicians, nurse assistant, and community health agents. The team are assigned to families in geographically defined areas. They are responsible for registering every family in their area, monitoring living conditions, health status, and providing primary care. In 1996, Brazil implemented the result-based financing to provide the necessary data to help them focus on increasing efficiencies and accountability. And since 2000, Brazil's federal health program introduced the National Emergency Care Policy in efforts to strategize and organize a 24/7 emergency response model, potential for local and regional flows of comprehensive emergency care.
Brazil has an innovative approach to healthcare through their Family Health Strategy, FHS, which is one of the largest primary healthcare programs. In 1994, the Family Health Strategy program started as a federal program to provide integrated community-based primary care. They have multidisciplinary teams that consist of a physician, nurse assistant, and 4 to 6 community health agents who are assigned a geographic area covering up to 1,000 households per team. Now, the program has expanded to include dentists, psychologists, and other specialists as necessary. These care teams are responsible for registering every family in their area, monitoring living conditions, health status, and providing primary care. They check in with families once a month to confirm that they have their medications filled, that they have scheduled follow-up appointments, and also look for risk factors such as signs of violence or drug use. Through the FHS program, Brazil has been able to bridge the gap between primary care and public health efforts.
Brazil faces many difficulties bringing healthcare to all of the people. Many people in Brazil still live in remote rural areas and cannot afford to go into the city, so healthcare needs to be brought to them. Many of these same people are elderly and suffer from chronic conditions such as diabetes and hypertension, which requires monitoring and counseling to help the patients control these chronic conditions. There is also a lack of government funding and a lot of inefficiencies, which causes delays in people getting the help that they need. Brazil's growing middle class is looking to private insurance where they can get faster, better care. All of these issues are forcing the government to innovate how they approach healthcare. Not surprisingly, the major innovations taking place in healthcare are in the field of technology. There are over 250 tech startups that are solving Brazil's healthcare issues. Remote technology allows exams, diagnosis, and monitoring to occur remotely, which allows the patient to get medical care where they are instead of having to travel hours to see a doctor. Mobile health apps help patients with mental health issues and chronic conditions manage their illnesses. AI is used to help with patient diagnosis and increase cost efficiency. Digitization of medical records allows records to be more easily shared and eliminates the need for procedures to be duplicated, which saves time and money. Lastly, digitization of prescriptions cuts back on errors and creates a database of drugs that can be used to identify drug interactions. Much of this data was pulled from the World Health Organization and the CDC websites, as well as other health reporting sites. I tried to collect data from the same years for comparison. As you can see from the chart, some of Brazil's numbers are similar to numbers in the US, while others are still far behind. The life expectancy in Brazil is comparable to that of the US, but the number of maternal deaths is almost triple that of the US. In 2005, the number of infant deaths in Brazil was 72, but the number dropped down to 42 in 2015. That same year, the number of infant deaths in the US was only 23. Although some of the numbers are improving, I think that the US and Brazil can learn a lot from each other to help improve these statistics.
The case presented several innovative elements that could benefit our healthcare system in the United States. However, one element stood out better than others and could drastically improve healthcare outcomes. Brazil's emphasis on preventative health and prioritization on preventing illness was vital to the country meeting the healthcare needs of individuals. Furthermore, the use of interprofessional teams was complementary to their overall strategy. The use of pharmacists, social workers, therapists, and others, and incorporating them as part of the healthcare team provided a level of coverage that would benefit individuals in the United States and potentially lead to improved healthcare outcomes. Moreover, there were also opportunities for Brazil to consider in improving their system. Of greatest interest is the expansion of technology and related services across the country. Some specific examples of this include the increased use of telehealth services, which would greatly impact the delivery of care to individuals in rural regions of the country. In addition, modernizing patient medical records and further expanding the use of electronic health records will also improve the delivery of care and positively impact access to care. Lastly, technology will facilitate the prescribing of medications online, which has the potential to reduce medical errors and increase adherence to treatment protocols.
Community-based care has shown to be efficacious in Brazil, first in being that through the FHS program, they've been able to provide care to 2/3 of their population. Their FHS program has not only improved healthcare access and quality, but also increased their patient satisfaction rates. For infants, the mortality rate has been reduced, and in adults, there has been a lower mortality from cardiovascular causes. Overall, the hospitalization rates have decreased from ambulatory care-sensitive conditions. Another key learning from Brazil's community-based program is that it is important to have plans to scale and expand as these federally funded programs create expectations within the community. So there must be the financial and human resources to keep up.
There were several takeaways from the case that are worth noting. First, as compared with the United States, healthcare expenditures in Brazil are significantly lower than that of the United States. In addition, Brazil is keenly focused on community-based care, and as a country, they are able to accomplish this goal through the family health strategy. Lastly, the greatest opportunities for Brazil to import innovations from the United States can be linked to the expansion of technology and technology-related healthcare services.
There is a shortage of doctors in Brazil. We recommend supplying more physicians in areas where it's difficult to retain these professionals long term. In order to streamline this process, we recommend a government-funded program like we have in the U.S. through the National Health Service Corp. This federal program awards scholarships to students in return for a time commitment to provide care in underserved communities. The program pays tuition and fees and provides a living stipend to students enrolled in a medical, dental, nurse practitioner, certified midwife, or physician assistant training, as well as expand the program to more specialists and community agents. Like my teammates have mentioned, Brazil has one of the largest healthcare markets and spends 9.9% of its GDP to healthcare. There is an aging population and poor management of resource. There is an opportunity here for Brazil's government to allocate more funds to healthcare for the prosperity of its citizens, with integral, equitable, and continuous attention to quality, efficiency, and access to care. Thank you.